Welcome to Nakuru College. My name is Magdalene Koech. I am a teacher for community health, and today we are going to be showing you practicals, especially on family planning, on MCH and the breastfeeding, showing you the right positioning and attachment of breastfeeding, danger signs during breastfeeding, and lastly, how to do nutrition assessment using BMI and using MALDI. Thank you.
I'm Mary from Nakuru College of Health Science and Management, pursuing community health. I'm going to take you through breastfeeding. We are going to check on correct positioning and attachment. And here we have the lactating mother and the baby. So we are going to start with positioning. Number one, the baby's head and the body should be straight. Then the baby's nose should be opposite the mother's nipple. Then the baby's tummy and the mother's tummy should be closely together. Like the baby should be close to the mother. And then the mother should hold the baby, the whole of the body, not just the neck. The patient is severely malnourished. When it goes to yellow, it shows that they are moderate malnourished. Then to green, this shows that they are fully nourished. So we are going to measure the baby. And the measurement of the baby goes to green. That shows the mother is breastfeeding exclusively to the baby. Now we measure the mother. And also for the nutrition status of the mother, she is nourished. That shows she's feeding well. Thank you. And I hand over to the next practical about BMI, and I hand it over to her. The fourth position, the mother should not just support the head of the baby, but support the whole body of the baby. So those are the 4 steps of correct positioning. We go to correct attachment. The mother should touch the chin of the baby should be touching the breast of the mother. That's step number 1 for attachment. The second one, the mouth of the baby should be widely open. Step, the lower lip should be more turned outward. And then the fourth step, most of the areola should be seen on the above than the lower mouth. So those are the correct positioning of attachment. How can we make sure that the baby is attached well? Touch the baby's upper lip with the nipple. Then, after touching the baby's upper lip with the nipple, wait until the mouth is open. When the mouth is open, pull the baby towards you and the baby starts breastfeeding. The signs of significant breastfeeding. The baby breast, when the baby is breastfeeding, the baby starts slowly while pausing. The other one, the cheeks start suckling when the baby is breastfeeding. The other one, the baby releases their breast when they are satisfied or when the milk is finished. And then the fifth, significant, the mother feels relaxed. From there we go to nutrition assessment, and we are through nutrition assessment we are going to use the mark tape. This small mark tape is used to measure the nutrition assessment of the child, and this one is used to measure the nutrition assessment of the mother. It has 3 colors. We have red, yellow and green. Red shows that if you measure your patient and it goes to red, that shows the patient is severely malnourished. When it goes to yellow, it shows that they are moderate malnourished. Then to green, this shows that they are fully nourished. So we are going to measure the baby. And the measurement of the baby goes to green. That shows the mother is breastfeeding exclusively to the baby. Now we measure the mother. And also for the nutrition status of the mother, she is nourished. That shows she's feeding well. Thank you. And I